Good evening, good morning, good afternoon. Welcome to the latest bulletin. UK health officials are advising schools on how to combat Strep A infections after the deaths of multiple children. The UK Health Security Agency (UKSA) has said that the figures for the disease are higher this year compared to the previous two. The increase in cases is likely the result of the withdrawal of measures implemented during the COVID pandemic, they add. The UKSA advises those who come down with the illness to exclude themselves from nursery, school or work for at least 24 hours after they start antibiotic treatment. What is Strep A, or gas? Strep A, or Group A Streptococcus gas, is a type of bacterium found in the throat and on the skin and in most people does not cause any symptoms, known as being colonized, the NHS says. However, it can cause a range of different illnesses of the nose, throat and lungs. It can be spread through coughs, sneezes and skin-to-skin contact. Those carrying the bacteria may have no symptoms, but are just as likely to pass on Strep A as those who have fallen ill. Symptoms for Strep A include pain when swallowing, fever, swollen tonsils with white patches, swollen neck glands, a high temperature or a skin rash. The bacteria can also cause any of the following: tonsillitis, pharyngitis, scarlet fever, skin infections like impetigo or erysipelas, cellulitis, pneumonia. Most cases of throat infection will get better on their own without treatment. Skin infections may require antibiotics. However, gas can also, on occasion, cause very severe infections, known as invasive gas (IGAS). What is IGAS? Invasive gas disease happens when the bacterium gets past the body's natural defenses and enters parts of the body where it is not usually found, like through the blood, deep muscle or lungs. The most severe forms of invasive gas disease are streptococcal toxic shock syndrome, symptoms of which include high fever, low blood pressure, scarlet fever, kidney or liver damage and vomiting and diarrhea, and necrotizing fasciitis or flesh-eating disease, which is an infection that causes tissue to become destroyed and requires surgery. Both of these are rare, but toxic shock syndrome has a high death rate. Treatments include different types of antibiotics, and depending on how severe the symptoms are, blood transfusions may be given. How common is it in the UK? IGAS disease is rare. There are between 2 and 4 cases per 100,000 people each year. Which version of Strep A has caused the children to die? So far, at least 7 school-aged children have died of invasive Group A Streptococcus. The UKHS confirmed 5 children had died of IGAS in England, while another pupil at a primary school near Cardiff in Wales also died after contracting Strep A. A school in southeast London also confirmed that a Year 8 pupil has also died. What should you do if you have symptoms? Contact your GP and get medical advice straight away if you believe you or your child have symptoms of either gas or IGAS. Strep throat should be different from a regular sore throat, as the pain can come on quickly. In response to the latest outbreak, a UK Health Security Agency (UKSA) spokesman said, "As part of our public health response to last week's tragic news, we issued some general information about the signs and symptoms of scarlet fever, which is not uncommon, to schools in the vicinity of Ashford Primary. A number of other illnesses typically circulate at this time of year and parents, school and nursery staff are advised to be aware of the symptoms, to keep up with vaccinations, and to seek advice from NHS 111 if they have concerns."